Music. It is an art of sound in time. It expresses ideas and thoughts using the elements of rhythm, melody, harmony, and color. Music affects the body and mind in many powerful ways. We can use music's qualities in a therapeutic relationship to promote mental, physical, emotional, and spiritual health. My name is SarahRose Black. I am a music therapist at Princess Margaret Cancer Centre in Toronto. I spent my entire life around music. I started taking music lessons at a very early age and was exposed to a variety of volunteer experiences in different healthcare facilities. And through that, I realized there was a huge connection between music and healing, and the two were very interconnected. I chose to pursue a career in music therapy, which for me was the perfect balance of being in healthcare and using music as a means of promoting health and well-being. I'm classically trained as a pianist. I also play the violin. Occasionally I have a guitar or a mandolin, a Tibetan singing bowl, an Indian harmonium. It really depends on the patient's needs, desires, requests. Music therapy is about relationships. It's about the use of music to create relationships in order to promote, maintain, and restore health. And that health might be physical, mental, emotional, or psychosocial. There are 4 main modalities of music therapy that I use with my patients. The first is clinical improvisation. This involves spontaneous creation of music and musical sounds by a patient and the therapist together. The second is receptive music therapy, or what I like to call interactive listening. And this is where the therapist plays or sings for the patient. The patient does not necessarily sing or play, they just receive the music.
You fill up my senses like a night.
The third is active playing. And this is when a patient chooses to play an instrument or sing a song, often in a particular style or a particular genre. The morning, the day, or evening. And lastly, I do a lot of songwriting, and this is when the patient and I will create a song, often with lyrics, that reflects the patient's experience.
Now meet some new bells.
Of PMH 14.
Beep, 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 beep. Anybody who's been there will recognize that. Beep, beep.
Well, that's amazing. So when I go into a patient's room, I'm using music as a way to connect to this patient, to create a relationship. And through that connection and that relationship, we can explore issues of health and well-being, whether they be around pain and symptom management, anxiety, depression, or even facing end-of-life concerns like relationship completion. Any images that came to your mind when you were playing the drum?
Oh yeah, oh yeah.
I wonder if you can keep those images in your heart, in your mind, for your whole week, if ever you experience anxiety.
I do my best.
Yeah, I know it's been difficult.
Let's show them all of these lessons, what I've done.
I work with inpatients on a variety of these issues, and it really depends on their wishes and their goals. It's very patient-centered. and also on their family members. If their family members have requests or needs, I try and work with those as well.
B flat. Have I got it?
You got it, and then
C.
Oh, this was our 50s tune, right?
Oh, okay. Are we ready?
We're ready.
Okay.
With my outpatients, people are trying to reintegrate into their everyday activities. And music can be a very helpful way to process what they're going through. Sometimes people tell me that they feel very disconnected with who they are after going through cancer treatment. And we use music to help them connect with themselves and reintegrate into their daily activities.
I think sometimes your mind can go into some darker places where you really don't want it to go.
Done?
And then the door opens and in comes SarahRose, who wants to talk music, play music, get you to participate in music. We had a blast just sitting on the side of the bed trying to think of tunes to stump each other.
Get a different C chord. Try that.
SarahRose spent time with me,
That's great.
talked to me, listened to my words, and created the music that boosted my whole body, my whole soul.
I will just sit and close my eyes and just float off in the music. I can't find words for it. I really can't. It's been fantastic. I wish I'd known about it much sooner.
I'm really lucky man in order to involve with that type of treatments.
When I walk into a patient's room, we're strangers. But as soon as we add music, the divide between us is completely dissolved. And we're no longer strangers. Music connects people. It dissolves divides. It allows me to hear people's stories and become a part of people's stories. And through music therapy, we create new stories. It is such an honor to connect with people through music.